Hello, my name is Kaylee Stavrilla, and my speech is going to be about the risk of whooping cough. Do you want to risk a child's life? Whooping cough can cause death in infants. It is important for anybody with children, anybody that works with children, or anybody that's just around children in general to get the whooping cough vaccination. Whooping cough is a disease that affects the lungs and is highly contagious, and it could possibly be deadly. In this speech, I am going to talk to you about the risks of this disease and what you can do to prevent it. Whooping cough is a highly contagious disease that affects the lungs. Anybody can get it, but it's really common in infants and it's deadly for them. The disease starts out as a big cough or sneeze that releases the whooping cough bacteria, and anybody that is exposed to the bacteria can get whooping cough. It is really likely for anybody that is living in the same household with somebody that already has a disease for them to get the disease. As stated in the article, Understand the Risk, it states the disease got its name from the sound of the breath intake that sounds like whoop. Some of the symptoms of whooping cough are runny nose, nasal congestion, watery eyes, red eyes, fever, and a cough. The doctor will take samples of the mucus in the nose and in the throat, and the samples will be tested for the presence of the bacteria, and that's how the doctor will diagnose the patient with whooping cough. Most infants that get the disease will be hospitalized during their treatment so the doctor can observe them to make sure everything is going okay. Antibiotics can help the infection to kill the bacteria, but it's not going to help the cough. As stated in the article, whooping cough, they say, death from whooping cough is most common in infants. Anyone that is around children should get the shot to prevent the child from getting the disease. It is even important for pregnant women to get the vaccination so the baby is already protected before it's born. It is a very common disease in babies, and it's really easy for them to get it, and they can die easy from it. Babies cannot get the vaccination until they are 2 months old, and they could get the disease before them. So if you want to save a child's life and prevent them from getting the disease, then it's highly recommended for you to get the shot. The biggest and smartest way to prevent whooping cough is by getting the pertussis vaccination. Doctors recommend beginning the vaccination during infancy, starting at 2 months old, and then getting it at 4 months old, 6 months, and then 15 to 18 months, and the last vaccination will be at 4 to 6 years old. After the third vaccination at 6 months old, the child is 80% immune to disease for up to 5 years. There are different vaccinations. As stated in the article, whooping cough vaccination, children that are under the age of 7 get the DTaP vaccination, and older children, teens, and adults get the Tdap vaccination. In conclusion, for everybody's sake, especially babies, it is important to get the vaccination to keep everybody safe and healthy. Whooping cough is very serious and it can easily kill people, but can also kill infants. So if you're around children a lot, get the vaccination. In my opinion, I believe that it should be mandatory for everybody to get the vaccination because it's not going to kill you, it's only going to help you. If you don't get the vaccination, then that's when it's going to kill you. I believe everybody should get it to just be safe rather than sorry. Everybody is brought into this world for a reason, so why would you want to take somebody's life away because you didn't get a shot to prevent a disease? Thank you.